Recreational marijuana use is already legal in many states, including here in Illinois, but Dr. Carl Hart is a firm believer that all drugs should be legal and regulated so that people who want to take them can do so in a safer way. Obviously a very controversial stance, and he lays it out in his new book, including his own experience with drug use.
His new book is called Drug Use for Grown-Ups, Chasing Liberty in the Land of Fear. Dr. Hart joins us live. Thanks for being with us.
Thank you for having me.
So I think when we automatically say all of this should be legal and people should be able to do whatever they want, people are thinking this is a nightmare waiting to happen. What do you say to people like that?
Well, I think the emphasis should be on regulated. My concern is that the drugs are, people are using drugs whether they're legal or not, but they're not regulated. And when they're not regulated, then we don't have any quality control. And then that increases the likelihood of people getting tainted substances and then people actually dying from those tainted substances.
Well, some might say that the prescription drugs and the opioid crisis, those were prescribed medications, and that didn't work out so well for, there's a big crisis.
Well, I think that they should read my book because they've been misinformed. But as you may know, these drugs have been regulated in this country for a good 100 years or so, and we didn't have such a problem that we have today. The problem that we have today with the opioids, the primary reason that people are dying is because of tainted drugs and also because of ignorance. People sometimes they are not informed that if you're going to be taking large amounts of opioids, particularly if you're a novice, you should not be mixing them with other sedatives like alcohol or benzodiazepines. And so what I'm trying to do is actually increase people's education about these things. And also I'm trying to decrease the likelihood of them getting tainted drugs like drugs that are tainted with something like fentanyl, which is potentially dangerous when people don't know what they have.
I mean, you talk about tainted drugs, but we've done countless stories here at WGN where we talk about teenagers who have OD'd on opioids. They got addicted because of a sports injury, and then they get it from a sibling. They can get it easily on, Craigslist and social media. How do you get through to a teenager? You talk about regulation. They're not really thinking about what's regulated and what isn't.
Well, when you talk about a teenager, first of all, drug use is not illegal for teenagers, and so parents still have to do their jobs. I mean, you can't expect us to parent for people. I mean, it's a shame when that happens. Obviously, children get in trouble from a wide range of activities, like their sexual intercourse is illegal for children to engage in, but yet some still do. So you will still have some of those problems, but you increase the likelihood of quality control for people who are legally obtaining these drugs. I am not professing to claim solve all the problems of society. That's not fair.
But we also know that, Nancy Reagan famously said, say no to drugs, and that was, they said that just did not work. Is the war on drugs working? What do you suggest should be done a little differently?
Well, the war on drugs is working handsomely well for a certain segment of our population, like law enforcement. Their budgets are increased. Prison officials, their budgets are increased. People who do urine testing for drugs, their budgets are just doing perfectly well. So it's working for a lot of people, but it's not working for the majority of people in this society. So we have these deaths, we have people going to prison, and so it depends on who you're talking about, because the war on drugs would not continue if it wasn't working for some people. Like today, we're talking about defund the police, but we're really talking about this war on drugs where policing kind of got out of control in a number of communities. And so we're saying defund the drug war.
In terms of your book here, do you organize the book in terms of the different drugs, and do you make an argument for the individual drugs, or are you speaking drug use in a general way?
Yeah, so in the book, I'm describing the drugs that people in our society are most often seeking. I'm talking about the psychedelic drugs like psilocybin. I'm talking about cocaine. I'm talking about opioids. I'm talking about the drugs that people seek in our society, the drugs that concern us in this society, the drugs that would have the biggest impact if we regulated them.
Well, for more, you can check out Dr. Carl Hart on Twitter and drcarlhart.com. The name of the book, Drug Use for Grown-Ups. Thank you so much for being with us.
Thank you for having me.